Welcome everybody to this info session on effect of yoga on diabetes. And thank you for coming. And good morning to everybody in India and good evening to people in US and Canada. It's my pleasure to introduce Neha, the facilitator for today. And she is an integrated yoga therapist, and she has a lot of experience in chronic diseases like diabetes, arthritis, Crohn's disease, and also she is an expert in Ayurveda. So without much delay, I'll get Neha on the spotlight and she'll start the session. And we'll have a question and answer session at the end and more information coming at the end of the session. So keep holding your questions till the end. If you have any technical difficulties, you can put in the chat box and let us know if you're facing any difficulty, but I feel everything is going good. So let me spotlight Neha. And Neha, floor is all yours.
Thank you so much, Ashna. Thank you everyone for joining in. I hope I am audible nicely, loud and clear.
Yes, you are. Yes.
Thank you. Okay. Good morning, everyone. I hope you all are doing great here. So today we met to have a nice talk on diabetes, and we know that diabetes is one of the dangerous disease that is not only increasing in India, but it is worldwide been affecting everybody. And can I have the second slide, please? And with our small effort, like we all in ICA and the team members are trying to just burst some myths, and we'll talk about some facts about the diabetes, which can help you all to have a better life and to lead a healthy lifestyle. As we all know that we all are the leaders of our health, and we all can lead it well if we have a good knowledge base. So first thing that I would like to burst a myth that we all believe that diabetes is caused only by eating sweet food. Definitely, sweet food do make a lot of difference when it comes to diabetes, but it is not only the sweet food that brings diabetes to us, right? There are many different factors like lack of sleep, then genetics is one of the cause, definitely. Then we have other causes like we feel tired, we feel bloated, lot of sugar craving because of the stress. Also, nowadays, people are not only stressed, but they're also very sedentary, right? COVID has also brought us to a lifestyle where we are working from home, and we all are not able to walk a lot. We're not able to move our body a lot. And there comes the, the role of our hormones and the diabetic. So when we talk about diabetes, it's the main organ, that is pancreas, that we talk about. So when the pancreas is healthy, it's the insulin that is being produced. And insulin is like, it's like a key. Yes. So our cells, so when the insulin is there, the lock of the cells is open up to take in the glucose. And that's how the sugar is maintained in our blood levels. Right, so we can see here very well that we have pancreas, which is producing insulin, and so the glucose is being attached to the insulin, and that's how the cells open up and take the glucose. And glucose is, we all are very much aware, is thing that gives us energy. That is why many a times when we are diabetic, we feel very low in energy, because the glucose mechanism goes very low. So in what happens in diabetes, it is immune cell destroy beta cells in the pancreas. It's an autoimmune system. It's an endocrine that happens, and pancreas cannot produce insulin. First thing which happens in type 1 diabetes, where there is more glucose in the blood, because we do not have insulin to get, where the glucose can get attached and we can have energy in the cells. In type 2 diabetes, where generally most of the people, 90% of the people are suffering from type 2 diabetes today. And in type 2 diabetes, what is being researched is also that it is basically when the insulin resistance happens. That means that insulin is there, either the pancreas is not producing a good amount of it, or our body is not able to use the insulin appropriately. So insulin is there, but our own cells are not able to take in the insulin. Okay, and then again, the same thing happens, that there is high levels of glucose. Can I have the next slide? Since I have already discussed it, that genetics is one reason, but unhealthy eating habits also takes us to, the feeling of fear, anxiety. Many people take eating as comfort, right? So why do they want it as comfort? Because of the high levels of stress, because of sedentary movement, less movement of the body. Our body hormones for we have hormones for everything. So the hormones which regulate our eating habits and satiation, okay, is not being produced properly. It's not only the role of insulin here, but then the role of other hormones also been effective, because the digestion, the overall system of our body is hampered. That is why it is also said that when diabetes come, it brings a lot of other problems with it. Yes, there are many other risk factors attached to diabetes, like high blood pressure. Then we have retinal problems. Then we have other lifestyle issues that is being seen. Thyroid is also, again, one of the problems because of diabetes. It all starts with it all starts in mind. It all starts with the fear, stress, anxiety. Okay, and that is why it is said to keep yourself calm, to keep yourself fear-free, to keep yourself anxiety-free, and to keep yourself happy. Okay. Yes, definitely. Now, the third reason that comes as improper nutrition, right? So what is improper nutrition? We all have been eating for very long. We all live with food only. But when it comes to nutrition, we all need to know, are we eating same kind of nutrition every day? Sometimes if we see that, people have same food habits, like every day they will eat the same food, probably like, maybe eggs every day, or maybe any kind of grains every day. But then where comes the balance to have all the nutrition? So improper nutrition, high carbs, right? We have whole carbs, but most of us are eating simple carbohydrates, right? So when it comes to nutrition, it is also very important to have food low in glycemic index, some food which takes some time to digest. Okay, once your metabolism is good, okay, once your digestion is good, slowly and gradually the resistance to the diabetes, to this insulin resistance also reduces, and our body works better. So here comes the role of exercise, definitely, and here comes the role when we can keep our lifestyle healthy. Yeah. Can I have the next? Yeah. So when we talk about diabetes, type 1, as I told, is like, okay, the organ is not functioning well, and the type 2 is when insulin resistance happen. But many people say that, okay, in type 2, we are just taking, let's pop in a pill and we'll be okay. We can pop in a pill every day and we can manage it, and it's mild. But do you really think it's mild? Yes, no form of diabetes is mild. As I told you earlier, that just diabetes brings lot of risk and lot of other complications, as we say that, it affects your brain, it affects the hormones level, it affects eyes. Many times if you talk to people who are diabetic and who are suffering with this, they say we are not energetic, right? The wounds, or if they get injured, they won't heal easily. Why? Because the whole mechanism is being hampered. Your heart, your kidneys, yes, the whole muscular skeleton system is being hampered. Why? Just because it's very serious. Okay, it's even life-threatening complications when it comes to it. And then what we have to do again is, yes, to take it, first of all, we should have good knowledge that it is not mild. We should know that what is it bringing along with it, and then definitely we should know how we can manage it. How we can manage with small changes in our lifestyle, with keeping ourselves happy, and keep the cortisol level, the hormone which is behind it, levels low. Okay, and definitely when I talk about cortisol levels and stress levels and keep ourselves healthy, I also talk about yoga, meditation. We'll talk about it later again. Can I have the next slide? Yes. So I talked about lack of good nutrition, but do you think that only eating healthy will help us? Let's have a good plate, lot of vegetables, lot of fruits, all the diet in place, good whole grains, and but will that only help us? Will that also help our pranic energy, the digestive system? Will it kick up our digestive system, our metabolism? No, that is not true. Okay, only eating healthy or eating wholesome is not enough. Okay, we need to have a pillar around our life on which our health is there. Okay, like we need to sleep well, we need to eat well, we need to move well. Okay, once we keep these three things in place, we feel happy, our hormones work better, and that's how we are in charge of our own health. When it comes to sleep, if you see that those people who work in shifts, okay, they are sometimes diabetic also, plus they're not able to lose their weight easily. Why so? That happens because of the hunger hormone, which controls our mind and our body and signals our mind that we are hungry. This all goes, it takes a back place. Okay, it's not working properly. So that is the reason that sleep is very important. That is where our lifestyle comes. Okay, we should sleep on time. We should wake up on time. We should have our daily routine in place. Once we keep our daily routine in place, then our body has a set clock which works accordingly. And then you work out, you do yoga and meditation. Now, yoga and meditation, nowadays we are listening, yoga is very important. Meditation helps us. But I take it as a comprehensive, it's a complete package. Yes, I think most of you will agree on this, because it is not any exercise that only is working on your physical level. Okay, when it comes to yoga, you have your body awareness, your breath, body awareness, your mind becomes calm with meditation. Okay, it's work inwards, not outwards. So that's why it is a complete package where you can actually work on your fear, you can work on your own beliefs, your thought process, okay, and you can remain happy. So you can actually reduce, scientifically, you can reduce the cortisol levels. When it comes to meditation, meditation always helps our parasympathetic nervous system. Yes, the parasympathetic nervous system, we all know there is sympathetic nervous system, and then we have parasympathetic nervous system, where sympathetic is fight and flight. Definitely stress is important to us. Our ancestors were those who used to live in forest, and they used to face to many of the stress, or some animals, and a lot of different things that they have to face. If they don't have that stress cortisol, then the body won't give more of sugar. What happens when we are in stress? Our body and our mind get triggered that we have to be safe. So there is either fight or flight mode. So when the body gets into this fight and flight mode, our brain gives automatically, the reservation of sugar comes into our blood flow. Okay, so that we get energy, quick energies to work and to have quick resolution and be away from our fear. Okay, but in nowadays, when people are working all the time and they are stressed all the time, continuous sugar levels are being there in the body, which is not helpful, which is not making us take quick actions. Rather, it is again a reason to diabetes. So there comes meditation, there comes how we can control our own emotions, there comes how we can actually calm down ourselves, hold down to our own thought process, and we can actually activate our own parasympathetic system, where parasympathetic is relaxation. Okay, it leads to a very well thought process where you can take your you can actually take decisions also nicely. Okay, so you should have more alkaline food, because we all know when the body system is acidic, it is not an appropriate place. Sleep, I have already talked. Deep breathing. So deep breath is a gift, I believe. Okay, when it comes to deep breathing, even when we are anxiety, what happens? We have only chest. You breathe so fast that and you start sweating. What all is that? That is all about your own system that is not able to handle the stress. But the moment you start deep breaths, the moment you are aware of your breath and the moment you actually have the coordination of your breath and your mind, all your glands work in such a manner that you are relaxed, right? And again, you can face, no matter what it is, you can face it well. Okay, yes, when it comes to deep breaths, it comes to yoga, meditation, more of movement is also needed. And this all definitely leads to our healthy emotions, which is our hormones. Can I have next slide? So yoga for diabetes. Yeah. So basically how now we know about yoga, we know about good eating, we know about sleep, we know about meditation, deep breaths, but then how is it good and how it will be helpful in diabetes? So since I told that there is two things, either the pancreas is not working well or the body is insulin resistant. So what happens, it stimulates the pancreatic cells. How it stimulates? When you do, when you do more of practices of yoga practices like Surya Namaskar, there are asana twisting asanas, then you get a good massaging effect in your organs, right? When that happens, your pranic energy, we have pranas. We will talk about pranas and pranic energy in our workshop as well. So your pranic energy get balanced. Yeah, we have panch koshas, 5 koshas is believed. So all those 5 koshas work together. Okay, so it stimulates your pancreatic cells, it stimulates the organs, and that's how this, slowly that depleted pranic energy, those cells which should be working properly gets the signal from our brain and they actually start working properly. Then the second is to reduce the insulin resistance. How will we reduce the insulin resistance? Again, that key is very important to open the lock of the cells so that the glucose is entered. That key will happen when you will work out, when you will have muscle mass. Yes, when you will use your fat, the deposit of the fat, because what happens when there is more of sugar, there's more of fat in your body. And that is also one of the reasons which blocks the cells, okay, which does not open that lock with that key of insulin. So when you work out, when you breathe, when you take deep breaths, your oxygens, your carbon dioxide, you feel detoxify. You detoxify your complete system. And that is how we will actually resensitize our own muscles, own tissues, fat cells. And that's how they start working in coordination. And that's how we reduce the insulin resistance. Can I have the next slide? So further, if I talk about yoga, pranayama, and meditation. So as I told you, it improves the glycemic control in our body. It increases the postprandial glucose system. That is when you eat any meal, anything, even a small snack, if you're putting a grain also in your mouth, it has some effect. Okay, so post-meal effects are being improved. It enhances your insulin sensitivity. As I told, that insulin resistance is improved. Definitely it will help you to manage the weight. Yes, once it will help you to manage the weight, it does not only helps the diabetes, but it improves and boosts your confidence. And ultimately, we all want to be happy. Okay, and once we are happy, we have that hormone balance and we feel really good about it. Okay, and then when your hormones are balanced, when you feel happy, when your weight is managed, you feel confident, definitely, you have a different life altogether to lead with. It reduces the dependence on drugs and insulin. Definitely, we are not talking about that you have to stop any medicine. Here only the role of doctor comes, but definitely the dependency may reduce with regular lifestyle management. It improves the muscle mass that I already talked about, how your muscle improves, how the mechanism of fat changes. Pranayama and meditation helps to calm down the mind and reduces the stress. Definitely, once the stress is reduced, everything comes in control. The other complications, which are, which does not come on the picture right away, but they are backseat. Okay, they will always take the back seat if you can have a good control over your own lifestyle, over your mechanism, over your own how the system works. So we all know we met together today because because not only to know about diabetes, but there is another workshop that we are going to take. It will be an 8-day long workshop where we'll talk about yogic management of diabetes. So we'll talk about prana, we'll talk about panchkoshas, we'll just dive in slightly more of what we had right now. And with me, I have the whole team of ICE to support you always. And we will be doing an what is integration is again, how your mind, body, your breath, every level will be dealing with. What you will gain from the workshop is, yes, you will again get to know about diabetes. Some of you, I've just read the chat, missed the first part, but that's okay. You can always register. Then we will be talking about yogic practices of management of diabetes, how yoga, different asanas, we have set of asanas, breath work, helps especially in diabetes. We will be also doing Yoga Nidra, which is a part of deep relaxation. And then you will get an outline of dietary management, that what food is good to eat, how you can manage your own diet. And we will answer all your questions, and there will be a private, there will be a WhatsApp group also where we'll be going hand in hand with you. So the upcoming workshop will be on 26th February will start, and there will be another session on 5th of March. So that's all right now. Thank you. And the floor is open for questions. Let's take 10 minutes for questions, and then we'll have a small touch of Yoga Nidra also. Yes.
A question, Neha, that do you deal with high blood pressure also?
Sorry?
Somebody is asking a question that do you deal with the high blood pressure also?
Yes. So what is high blood pressure? Okay. So we have we have the veins where the blood flow is there. Okay. But what is blood pressure? Any pressure. Okay. For example, you have a tube, and the tube is, it have a thickness. Okay. But slowly and gradually, either the tube sinks or the tube gets, there is a layer of, let's say the layer of any garbage or anything that covers the tube, and it makes it thin. Okay. And then how the same amount of water has to get into the tube. The same amount of blood has to get into the tube. But will that happen? No. Okay. That won't happen. So the push will be there, and there comes blood pressure. Okay. Now again, why that push is there? Why the tube has gone? It's again all related. Okay. It's again the fat deposition. It's again the stress. It's again the hormone. Okay. That is why, yes, we deal with the blood pressure as well. I hope I have answered it well. Any other question about the same?
You can, anybody can unmute and ask the question. If you have a question, if you don't want to type in the chat box, that's fine.
Ma'am, I have a question.
Yes, Mukesh.
Yes, please.
See, what happens is at present, I am not able to do all yoga asanas because I have a very severe low back pain. So will the workshop help me is the question.
Okay. So, sir, thank you for your question. So when it comes to lower back pain, I need to know that how much are you able to, how well are you doing your daily activity? Okay, because we can always downscale and upscale our practices. We can always use chairs, blocks to do the same practices which we are doing it without it. But then we need to listen to our body. So we should know that what are your activity levels, and then definitely it will help, because it will not be only the practices, but there also we will be talking and we'll be sharing our other knowledge.
Basically, this is the sciatica pain I have. So because of that, my right leg, a lot of times, it gives me problem to do any yoga posture, especially where bending and all is involved. So should I wait for it and then maybe take another later on if you have a diabetic session, or do it now itself?
Okay. So, sir, see the second, like sciatica, again, First of all, we always need to listen to our body. We will always say that listen to your body, okay? But sciatica, yoga also helps sciatica, okay? It is not only that the asanas that we'll be doing will be only helping in diabetes, okay? It's again a package which helps like body, mind, and your breath, okay? But you need to listen to your body. You need to probably when I can see you or I can, I need to know how well you are moving. And then we can definitely do it. There is no problem in doing it, but you can do a lot of asanas, like even Surya Namaskar can be done on chair. Okay, most of the asanas can be done on the chair. When it comes to Shalabhasana, then it's good for sciatica, in fact. But
Okay,
the call
thank you,
that,
ma'am.
yes, but the call is only dependent on the movement.
Right. Thank
And
you.
if you're able to do your daily work, if you're able to, if you're going to office or if you're able to do whatever, there is no hindrance in your daily routine, daily work, daily activities, then you are perfectly good to join.
Fine.
All right, we can take another question.
Hi, I'm Brahma from Canada. Do you teach yoga for high BP also?
Just answer.
Yes, we do. Yeah, we'll have upcoming workshop for thyroid, high blood pressure, different conditions throughout the year. So just wait for it. We'll send the information in the group. Okay.
I see. Thank you so much.
Anybody else has any question?
Yeah, I have one question, please.
Sure, Aarti ji, go ahead.
I just want to know, since we don't stay in India, what are the timing for the workshop so that, conveniently when you are holding the workshop, we prefer to be there.
It's the same time what you're having now,
Yes.
7 to 8 Indian time, which is North American is 8:30 to 9:30. Yeah, so if this time is suitable for you, and during the weekend, this will be timing, or it can be 7 to 8. It can be earlier also because of the time zone changes. We could also have it from 6 a.m. to 7 a.m. IST, which will be again 8:30 to 9:30 from March, right? So this is the only, and then during the weekdays also, it will be similar time, either 6 a.m. or 6 a.m. would be the time mostly in the morning time in India. So that's, I think, around this time in North America, in the Toronto and New York zone.
And 6 to 7 will be 1 hour workshop.
It's always one hour. So it'll start on a Saturday and end on a Saturday. So it'll be from Saturday to Saturday, 1 week fully, full diabetic workshop. It's starting on the 20th, this Saturday, coming next Saturday, 26th, and then finish on the following Saturday.
Yeah, 5th March.
Yes.
Thanks a lot.
Yes, and I'll send all the registration details if you're in the WhatsApp group. All the registration details and the forms will be shared there. We are from ISAFE Foundation, which is a non-for-profit organization based in India, but we have globally teachers who work towards this cause. Yes, we do private sessions too. If you're interested, you can let us know. We'll arrange that for you. And you can email us also. I'll send all the information by tomorrow in the WhatsApp group. Okay.
Ma'am, one question from me. I'm from Bangalore.
Yes, sir.
Can we continue the exercise along with this yoga?
Yes, of course. Whatever general exercise if you're doing, you can continue. I mean, you should not overload with exercise for sure, so that your muscles get too tired. So you can discuss that if you start the workshop, what you can do, what you cannot do, and also how much gap you should have. That all Neha can guide you through once you join the workshop. Okay.
Okay. Okay. Thank you. Thank you. Thank you, ma'am.
Yes, sure. Anybody else has any question? Just unmute and talk, please.
Hi, I'm calling from Australia.
Hi.
And I'm a little concerned about the timing only because I work pretty long hours. And I was wondering if there's an access to a recording. And I mean, I would love to be at the talk, but that being said, it's not going to be possible for me. So I'm just wondering whether there's access to a record or a recording, or perhaps even an opportunity to speak to someone when I've managed to catch up with the workshops.
Yes. We do record the sessions, and definitely, are you in the WhatsApp group? So I can, you can just text that so that we can reply to you privately, okay? So that just
Yes, sure.
put a text across that whatever you said right now, that you're from Australia and looking for a different timing or something, we can definitely address your concern, because we do have teachers in the Australian time zone also, okay? So we could
Yes,
arrange a
wonderful.
session for you, because we have a teacher in Adelaide, Australia. So I think that will be more suitable for you. And we have teachers in the North American time zone also. Okay, so just text us
Wonderful.
all your queries, put in the WhatsApp group, and I'll answer all the queries as we get. Okay.
Right. Thank you.
Somebody has a hand up, 1+5. You can go ahead, unmute yourself and ask the question. Whoever has the hand up. If not, we'll take another question if anybody has any question. No more questions? All right, great. So maybe you're still contemplating about all those things you have heard. So just stay tuned for more information coming about the workshop, the 8-day workshop. And you can ask any questions. If you're not comfortable asking now, you can ask any question in the WhatsApp group, okay? Please refrain from personally directing the message to either Neha or me, because it's too much sometimes for us. Just put all your questions in the WhatsApp group, okay? So that's the request. And I can only say that yoga is an exciting journey, and it will definitely help you no matter what your health situation is. So do come with an open mind and willing to try. And ancient rishis had a different vision of our body, like they knew all the body system, but they also had another vision of Panchakosha, as Neha said, that we don't only function at the level of body, we function at the level of our pranas, which is the energy force, vital energy running all the systems in our body. And then on top of that, there's a Manomaya Kosh, which is the mental layer. So we work on different layers, and everything affects our body. And yoga targets each and every layer. Yoga is not about twisting our body, yoga is about straightening our mind. So once we start working on our mind, everything gets streamlined. That's how it works. It works from within our mind, inside out. So it's a good opportunity. And because we are a non-profit organization, our rates are very subsidized. You'll be surprised how subsidized it is once I send the information. So do take advantage, because our mission and vision of our foundation is to spread health and wellness through yoga, so that everybody becomes disease-free. That's our aim. All right. So with that note, I'll end the meeting for today. Thank you so much who joined us, and do share your thoughts and questions in the WhatsApp group. Right? Thank you so much. Namaste.
Thank you, everyone.